was just talking with a lovely client who was saying when they are on the GLP-1s, they don't feel hungry and they feel kind of nauseous, and they're thinking they need food that's easier to digest. Well, this is kind of a problem because actually how those GLP-1s work is increasing the time between eating. So I used to think, and med school even taught me this, and dietitians even taught me this, that if you don't eat 6 tiny meals a day, your metabolism will go down. No, that's crap. That's not true. If you don't feel hungry, I give you permission not to eat. You can have a seltzer water. I just had this Waterloo. Develop some other non-caloric beverages, not diet soda, but like other beverages you can have for instead of a snack, have that instead. And realize it's the time between eating that is healing your pancreas and allowing the insulin to go down so you can release the weight. Take a nap. You can take a nap. Oh, it's terrible because I got my teddy bear here. Who takes a doctor seriously who has a bunch of stuffed animals? But anyway, basically take a nap. If you feel tired on the GLP-1s, take a nap. It's okay to also just cut off eating at the end of the day early. If you go, I feel tired, I want to rest. You know, this whole nonsense that we need to eat every couple hours is killing us and burning out our pancreas. And it's something new. You know, these people, my ancestors, did not snack. There was no snacking. Your ancestors didn't snack either. And look how they age. They're aging so much better than my generation. So if you don't feel hungry on a GLP-1, I give you permission not to eat. Now, of course, if you have a history of eating disorder, these are different things. If you're a young woman who's not eating anything and you're underweight, please don't do this. But I am 57 years old. The odds of me becoming Kate Moss and becoming a supermodel who doesn't care about food is about 0. I love food. I've always loved food. And if you're a woman over 50, you're not gonna do that. You know, it's just not gonna happen. So again, I give you permission not to eat a meal, to cut out eating early, to skip breakfast, to eat 2 meals a day, to eat 1 or 2 meals a day. But make sure you're hydrated, make sure you're drinking enough, and I look forward to seeing you in the next video. This is Dr. Sarita, Question Everything Behind Weight Loss.